Good evening, everyone. Welcome to the Health and Wellbeing Board. And it's nice to see people back from holidays and everybody here looking sprite and well, especially after the day we've had today. Yes. Okay. So I wasn't going to do introductions. We'll go straight into apologies for absence. I think everybody knows each other in the room, so I'm not going to go around and take time to introduce ourselves.
Yes, okay, Chair.
Apologies, please.
Thank you, Chair. Apologies received from Dr. Nina Pearson, Vice Chair, Councillor T. Salim, David Carter, Felicity Cox, and Lucy Nicholson, Chair.
Okay. And we are quorate, so we can start. And the first item is the minutes, but it is the minutes from the last meeting, which I wasn't at. And that meeting was in quorate as well. So you really do need to approve these minutes tonight that you've got before you. Okay. They agreed? Thank you very much. And the first item on the agenda, well, just to remind you of disclosures of interest at item 3, we've no urgent business, no references from other committees or no disclosures. Okay. And we move straight on to the reports. And the first one is the update on COVID-19, item 6. And I think that's you, Sally.
Yeah. Thank you, Chair. So the paper is included. The update is mainly around the ability to have a meaningful paper actually in these meetings. So at the moment, obviously, we are aware that the community testing that we had previously isn't in place anymore. So the ability to report realistic and accurate rates is not there. So there isn't really the need to be talking about the rates. What we can look at still is hospitalizations. And at the moment, there's 115 patients in the L&D with COVID. That doesn't mean they were all admitted for COVID, but they are in with COVID. And we had 5 COVID-19 deaths registered in Luton over the last week. We are a big part of what we are still doing around COVID, of course, is the vaccination programme. So we're still working very closely with the NHS around the vaccination programme. We have our hub in the mall in the old post office site that is still seeing a good throughput of vaccinations. And we are now in the rollout of the dose 4 for those that are eligible, and that will start being rolled out now into care homes. HCT, who are the provider, are starting to book appointments to go into care homes now. And I've seen the timetable for those visits, so I know that they are in train. So I've also attached within the papers an appendix which summarises the changes to our response to COVID, because we are in a very different picture now. So we're stepping down various groups that we have in place for COVID, and obviously with in mind that the data that we can look at now is much reduced. So we don't have our weekly outbreak management group meetings anymore. We don't have our fortnightly health protection COVID committees. We've dropped those down to monthly, and they will then form part of our regular health protection committee, which is a quarterly meeting. So it will be more of a agenda item in there is the plan, unless anything changes over the summer. I think it's probably, I took a paper to health scrutiny last week, and we had a discussion about whether it's still worth having it as a standing item there. And the agreement was that it would still be for now, because we can still look at the hospital position, we can still look at pressures across the system, but it is a very different position as to being able to talk about outbreaks in schools and care homes, etc. So I suggest probably we'll continue having reports as a standing item here for now and raise issues as they arise, but it will be quite a different type of reporting now with the reduced data that we have and the reduced response that we have. So happy to take any questions.
Okay, thank you, Sally. Any questions from anybody? Yes, Phil.
Actually, I was just waving to Nikki walking in, but right. I would ask you a question, which is my favourite one. Do we know what the situation is in care homes with?
Yes, so in care homes they are still testing a lot more than in the general community. So staff in care homes still have regular twice-a-week testing, and they do not as regular but regular resident testing as well. So we do know that we have a number of cases in care homes at the moment. I think we have 4 classed as outbreaks because there's been positive cases, but they're all asymptomatic. So it seems calmer in care homes at the moment, but there has been quite a lot of changes to the guidance, and so we've done some communication to the care homes, and I attended the provider meeting this week just to discuss any changes to the guidance and any concerns. So the vaccinations are going out starting this week to the care homes, and they have updated guidance and testing. They're still able to get tests from the portal. So it's relatively stable, but there are still cases in care homes.
Okay, Phil. Anybody else? Yeah, David.
Thank you, Chair. So one of the concerns would be for the free testing is now obviously no longer available. Is this something that we can support for people who want the testing but can't afford it? Is it something that we would be able to support? Do we have any COVID funding left over that just to help the people? So just by offering kits to people so we can limit the spread.
So I think it's a challenging one because I think there would need to be a clear rationale for those tests and who we would offer them to. The reason why they're still offered in care home setting, for example, is because they work with very vulnerable people, and they're still offered in other adult social care settings as well, and they can still get them from the portal. So I think if we were to do something like that, it would be quite difficult to set the criteria of how we would do it. Do you want to come in, Robin?
Yeah, and just to add that the COVID funding is almost entirely gone or allocated now, and we don't have a budget within the council's permit to fund that.
Yeah, I was looking to see if we had any COVID funding, but if it's allocated, we haven't got it.
Anybody else? Oh, yes.
Yeah, apologies,
That's okay.
just to say that anyone who's identified as clinically vulnerable will have access to tests, and that's because there's some antiviral treatment. So if you want, I can get that detail to you. So they are a cohort of patients where it's been protected, that testing.
Okay, thank you. Anybody else? Be happy to note the report. I think that's what's on there. The committee is recommended to note the report. Be happy to do that tonight. Thank you very much. We now move on to item 7, which is the public health intelligence update. Is that you as well, Sally?
Yes, I think the majority of the papers are me today.
I think that your name is by most of them. Yeah.
So you're going to get a bit bored of hearing my voice. Yes, so this is an update. We brought a paper in October last year around our progress against the Joint Strategic Needs Assessment and building our public health intelligence capacity. So this is an update on that. So in the October paper, I outlined the plans for having 2 main JSNA documents. One that lays out all of the demographics and important points around Luton as a place, and the other one that's around the health and care demand and needs within the Luton population. So appended to the report is the This is Luton one around the demographics and Luton as a place. So we have one place where all of the key demographic facts and figures and population modelling it is, so we can all as a system refer to that document. We've also taken forward the pharmaceutical needs assessment, which is a statutory requirement that you have to do every 3 years. So that's on track and work is underway on that. Once we have both of the new JSNA documents, we'll be relaunching our Observatory. So I'll bring another paper around that next time. But both of those documents will be on there, as well as a dashboard and some deep dives that we will be ongoing pieces of work. So we'll be doing 3 or 4 deep dives into the data per year, for example, around mental health, alcohol. And the ward profiles and practice profiles that we've produced will also go on to there. We're also working on what's called population health management with NHS colleagues, which is around linking data sets between health and care and other data sets to identify higher risk cohorts and then be able to develop interventions. So that's a big work stream across BLMK. And then we're looking at our Luton place-based approach to that, looking at risk stratification and identifying cohorts. So that's ongoing, and we're doing a particular bespoke piece of work on that over the next year. We've also had conversations around setting up a BLMK public health observatory. So I mentioned this last time, and it's still in development in terms of what that might look like. So it would just be around sharing resources and ways of working and data sets collaboratively, so that across the ICS footprint, we've got one approach to looking at data and having a public health observatory across that footprint. So for example, we might have a similar format for the ward profiles, so that across BLMK, the data that we're producing is in line and looks similar and has a similar way of publishing that, so that it's much more coherent. So I think those are the key points in the paper. And as I said, the appendix is the This is Luton document, which is the first JSNA publication. Thank you.
Okay, thank you, Sally. Are there any questions? No? I noticed through the report the issue of the difficulties in the average 9 years less than those from other parts of the town is repeated several times, and I think we really do need a programme in place to say, how are we going to actually address that? It's not new, we've known it's been there for a long time. How are we actually going to tackle that issue? And I think the JSNA is the right place to say that's what the problem is. It also should be the right document that tells us how we're going to look at least addressing it.
I think that's a really fair point. I think there won't just be one way of addressing the difference in life expectancy, and through a lot of our public health programmes as well as wider council programmes, that will form part of that. So within the Luton 2040 dashboard, that's one of the overarching key indicators that show how we're moving that forward. So it's not an easy thing to shift, but yeah, absolutely agree. It should be a key priority.
I think there's some issues come out of this that have been with us for a long time, and that we need to, whatever we do in the JSNA, it has to show how we're trying to address that, however it be, because for me, they're not, without addressing those, the rest of it doesn't matter really. So for me, those are core, that housing, there are some very core messages here about health and housing and poverty that we should have answers to, how we're at least attempting to address it. Otherwise, it kind of doesn't make much difference.
And I think the role of the JSNA is to understand that picture and understand the population and have lay out the needs within a place to then inform work programmes. So we haven't had an updated JSNA for a while, and we now have, although we, collectively a lot of this data isn't new. We've, as you said, we've seen it lots of times before, but it now lays it out in one place, and it should. The idea is that it should drive work programmes and commissioning. So it needs to be shared widely and various teams to have a think about work programmes related to their key topics.
It's not a criticism, Sally.
No, I know.
It's a fact,
Yeah.
These facts. Yes, Mark. Sorry,
I think there's an opportunity, Sally, if we're thinking about the JSNA and what it would put, because it's telling us where we are. That's a moment in time, isn't it, very much? And there's the opportunity when we start to talk about the place-based work later, Sally, with the work programmes. I think there's maybe something for us to take away as officers and actually try and start to map some of those work programmes against some of the needs that are emerging through the JSNA, and actually see what work activity. Yeah, completely, absolutely, Kate.
Yeah, and Robin's just whispered in my ear, the population wellbeing strategy that we have, that is part of the Luton 2040 strategy and is owned by this board, is all about delivering against the JSNA priorities. And I've brought that through here before, and I think that the timing of, we should present the JSNA, that then informs the strategy. I've just done it the other way around, but absolutely, the key indicators within the JSNA are addressed through the population wellbeing strategy.
I don't mind where it comes and which report it goes in. It's how are we, as a Health and Wellbeing Board, going to take that forward. I think that's the thing that I'm saying we now need to sort of really focus on, those bits. Yeah. Okay, has anybody else got any questions? Okay, we're happy to agree the report. Thank you. And we move on to item 8, which is the Healthy Place position statement.
So this paper lays out an approach that we are taking to set out the principles that we as a Health and Wellbeing Board would like to see as part of a Healthy Place position statement. So it's come from the place of a lot of discussions around fast food takeaways, healthy streets, licensing, and how we could do more in that space. So what we've had lots of conversations outside across different departments around what can we do about this. We've got planning that do a lot of work in this space. We've got licensing that do a lot of work in this space. Can we be doing more? The local plan is being reviewed, and that's quite a long-term project. So in the interim, what we've suggested is that we have this Healthy Place position statement, which lays out our commitment as a Health and Wellbeing Board to Healthy Place. It's not a material consideration as part of planning, so it's not a policy in that way, but it lays out what our values are as a place and as a Health and Wellbeing Board. That can be referred to, and it sets the scene and sets the direction of travel for the local plan as it gets refreshed. So in the appendix of the main report, there's two grids, two sort of 4x4 tables, 2x2 tables, sorry, which lays out in different sections what our core values are in this space. So around movement and access, housing and building design, open spaces, play and recreation, compact neighbourhoods, healthy food environment, healthy high streets, local economy, and air quality. So the idea of bringing it here today is to get views on this as a statement, any further input or thoughts around it, and then hopefully signing off that we can then publish this on our website and circulate it. But as I said, it's not a material consideration in planning applications, but it does set our values and our core commitment to Healthy Place.
Okay, thank you. Are there any questions for anybody? Yes, Robin.
Sally, how would we move this into being a document that people had to abide by rather than a reference document?
Yeah, it's challenging. I've had lots of conversations around that with planning and other colleagues, and at the moment, I don't think we can. And in preparing this paper, I knew that was going to be the question, because that is what's really important, isn't it? So we've had lots of conversations around that, and at the moment, I think this is as far as we can go until it gets put into policy in some of the local plan refresh. So within that, there will be certain sort of hooks that you can add in bits of this and develop it as part of policy. But I think having this in place here now as this position statement sets that direction more easily, so it gives us the opportunity to build it into the local plan refresh as we go.
Can I just ask, how are we going to link what you've got here in with the sports and activity strategy that will be coming before members policy group shortly? Has that been talked through with the sports people? Because they'll come up with their ideas, and I want to make sure we link in some way.
Yeah, it's so Matt and my team, who leads on the physical activity strategy, will have seen this. People that work in transport and planning have been involved in this. So the bit around people feel safe walking and cycling absolutely is part of what they're thinking as well. So all of the across all the different departments, people have been spoken to about this licensing around alcohol consumption, for example. So it's quite a holistic view of where we want to get to.
Okay. Anybody else? No other questions from anybody? So are we happy to agree the recommendations from the report? Okay, thank you.
That's great,
we
thank you.
Move on to the Health Inequalities Delivery Board.
So, so this is the usual update paper as one of the key delivery boards of the Population Wellbeing Strategy. We're in a position where there's a later paper on the Place Board and how that, setting out the priorities for that board and how that fits with the Population Wellbeing Strategy. And with that in mind, we've been doing a bit of a refresh around the Inequalities Board and thinking about which priorities should sit in the Inequalities Board and how would we drive that forward versus Place Board, and also the Children's Trust Board, where the Starting Well and young people's elements of the Population Wellbeing Strategy sit. So in the last Health Inequalities Board, we started to do a workshop around setting our priorities, which are laid out within the paper. So we're looking at physical activity, mental and emotional wellbeing prevention, inclusion health, which includes groups that are more likely to be disadvantaged, so homeless, asylum seekers, disabilities, carers, etc. Contributing to the NHS Core 20+5, which is a key area of inequalities work within the NHS setting. So it's looking at the 20% most deprived areas and 5 clinical areas, so maternity, SMI, respiratory disease, cancer and hypertension. So it's a very health services approach, but looking at the inequalities in outcomes of those areas. So contributing and thinking through some of that. Smoking prevalence, healthy and sustainable environment. So some of what we've just been talking about around the healthy position statement. Structural inequalities and fairer town. So looking at the Talk, Listen, Change project that we've led before, having some of the oversight of the Marmot work and some of the community recovery fund that we've used some of our COVID money for, and healthy communities. So looking at the voluntary community sector and empowering communities to be resilient. So those are what we're looking at as our priorities within that board. And then we'll obviously be interlinked to Place Board and Children's Trust Board for some of that as well, and particularly thinking about Child Friendly Town, for example. So we'll work that up further for the next Inequalities Board and have further discussion about what that means, the actions are, and how do we drive things forward, and how do we ensure an interrelation with Place Board. And as part of that as well, we'll be doing a refresh. So we've had a whole set of KPIs for all 3 of the boards, well, not Place Board because that's new, but Transformation Board prior to that, and they've sort of gone off the radar a little bit. So we're going to do a piece of work refreshing those KPIs as well and making sure we're clear. How do we know what we're doing is having an impact? We'll stop there and open for questions.
Are there any questions? Yes, Javid.
Thank you. Thank you, Chair. The board received an update of CEO Bedfordshire Community Foundation, BSF, on delivery of the Community Recovery Fund. Now, it says 43 groups were successful getting the money, and there's going to be 59,616 residents who are going to benefit. How are we going to measure that? So
the LCF are managing that community grant for us as part of Cobid recovery, and they're building in evaluation into that. So at the moment, the paper just has top line numbers of groups that have been funded, but we're building in evaluation around numbers of participants impacted, looking at potentially some of the scales of wellbeing and for those participants. So we're building that in, but we haven't fully worked that up yet.
That's why I was interested to find out what the KPIs will be.
Yeah. So I can bring more detail around that to a later meeting for the next Inequalities Board update.
Okay. That'd be useful, wouldn't it? Anybody else? Okay, happy to note the progress. Thank you. We now move on to item 10, and I believe that's a presentation by yourself. Am I right?
This is with Sally again, actually. Exactly. So I feel like it's a Sally show, isn't it? But we could do this together.
Okay.
So the presentation is in the papers. Do you want it up on the screen separately, or is everyone happy that it's in their papers? I can
It's in here. You're putting this out, aren't you? So
yeah,
we've got it. Yes. Don't worry.
Okay, great.
Oh right, it's up there anyway.
Oh, it's up there. Great, thank you. So we can do a triple act. So the place board is well underway. So there's a paper later around governance around integrated care, the new integrated care system and integrated care board. So this isn't about that bit around the governance and membership, etc. This is about the direction of travel for the place board and the priorities that we're setting. So it's a collaborative board between health and care and voluntary sector partners as part of the ICS. And we've been doing quite a lot of work around the priorities that sit in the place board and how we drive things forward and how we work as a system. So these are the strategic aims and the priorities that we have agreed on as a place board. And they are taken largely from the population wellbeing strategy that this group this board has ownership of and helps drive forward, and also from the priorities from the CCG and the health system 10-year plan as well. So it's a combination of both. For each of those priorities, we've set an SRO to help move those forward. And then underneath each of those priorities, if you go on to the next slide, we've got some key areas of work and objectives. So there's a clear recognition that not all of the work will happen in place board, but that the coming together of all of the related parts of the system can help problem solve and drive things forward. So in the last place board meeting, for my priority 1, I presented on the progress against each of those, what projects are underway, who's taking forward different pieces of work, and it led to some further meetings being set up, particularly springs to mind around the learning disability and autism item. It's led to a collaborative meeting between Michelle on the call and myself to move forward the health checks in those groups. So it's about that collaboration and system working across those objectives. If you go down to the next slide, so I won't talk through these one by one. What I will mention though is that the priority 4, which is around the children and young people, these are the priorities and objectives that sit in Children's Trust Board. So the work for these will happen through Children's Trust Board, but there needs to be that interface around how we deliver across the system. So Children's Trust Board may raise agenda items to Place Board and vice versa, but it's around health and care services coming together to problem solve some of those issues. So if you go down the slides to the one that has the Place Board programme, so I'll skip through these priorities. So we're just working through how we work as a system. So a key part of the Place Board is working with the primary care network, so the GP practices and services around those practices. We've got a programme manager and team that are helping work through the priorities and objectives and how we manage that. It will be iterative and flexible, so we need to flex to meet the needs of the population and vision for Luton. And we have those work stream leads that I mentioned. And then on to the next slide. So a key part of how we have decided we're going to work is we're setting up a Memorandum of Understanding, which is appended to the papers as well, which consolidates and formalises the commitment to working together and how we will work together, what our vision is as a collective, how we will show leadership and meet the changing needs of our residents and improve health and wellbeing of the people of Luton. So we've drafted the Memorandum of Understanding and it's in the papers, but I think it's about really everybody signing up to a way of working and a commitment to working in this way. I think that's the last slide. So as part of that Memorandum of Understanding, it's a mutual accountability framework which sets out what everybody is going to do and the role they will play in the board so that they're interrelated. And then just one more slide on the governance structure, so how it fits in with this board. So the Health and Wellbeing Board has the ownership of the population wellbeing strategy. And then, as I've said, Place Board is one of the 3 delivery arms of that strategy. But then it interplays and interlinks to the integrated care system, integrated care board and integrated care partnership. Nikki, Mark, anything to add?
So can I just add that what's really important, I think, for the Health and Wellbeing Board is that the Luton Place Board is really influential for local decision making. So it is the place where we're absolutely looking at the population we have in all of our wards. So the primary care networks are GP practice populations. It's not just the collection of GP practices. So we're talking about a population, and we all know that not everybody in Luton registers with their practice because we're very flexible with our boundaries. So we need to recognise that our primary care networks are our populations, and the whole thrust of this is how we actually are getting what I call multidisciplinary team working, and the community and the voluntary sector, as Sally said, is really, really critical. So, and I know some of you have seen it in previous health and wellbeing boards about the wider determinants of health, and Hazel, you've mentioned it earlier. So we, and I've got a health badge on, have recognised that we are a minority player in the sense of making health and wellbeing if we work in a silo, which, let's be honest, previously that's how, nationally health has been a bit in a silo. So this is absolutely putting Luton at the centre and front of everything. So the Place Board, and I think the governance chart that Sally mentioned is really important. So we're at a Luton level, no, we're not duplicating effort. So equally, the Place Board will be really influenced by the work of the Inequalities. So we're being informed by that work. Equally, the work that Amanda does with the Children's Trust Board, it's what elements we need to sit at the Luton Place. So I think for members, and at the last Place Board meeting, Phil beautifully went through the accountability framework, which for me, it's about behaviours. It's absolutely about behaviours that will make things different for people in Luton. And we had Sonal a few meetings ago, which is helping us bring in the community and the voluntary sector, because that's where the energy and the power is. What I think, and Robin, I hope you don't mind me saying this, but the Luton, we are further developed in the place. So we really need to make sure that we build on the success we've got and get the governance right so that we can really make a difference. Hazel, you said just briefly, about the housing elements. We have those ability now to start influencing that. And that's where I just think we need to make sure that we're using the new, will be the health and care partnership, really to the value and to the benefit of the Luton population. So I'm really pleased to be part of it. And I think that the 6 priorities we've got are absolutely pick up with Sally's JSNA work, the priorities of Luton. So it doesn't mean where we're working at scale, the Luton population benefit, but where we need to do some targeted work, and we know mental health, we've got Michelle on, and we know the LD, and we know some of our end of life care pathways, we don't do as well in Luton. So hopefully it will start addressing some of that inequalities that is our challenge.
Okay, thank you. Thank you for that. Any questions from anybody?
Can I just add to that as well?
Yeah.
Because I think Nikki's beautifully summed it up. But coming back to the point you were making earlier, Hazel, about how do we drive better outcomes from the JSNA?
Yeah.
This is the vehicle. I think we're saying that how we're going to drive those outcomes, how we're going to monitor it, and how we're going to hold each other to account as well. And I think what's really useful and powerful in what we've set out here is the Memorandum of Understanding and that accountability framework as well, because it will drive different outcomes from people at a local level. Mm. But one of the things I would ask the board is just with regards to the priorities, do they feel like the right priorities? You've probably seen these through different iterations before, but are these the things that we should be focusing on? Because there's a plethora of things to do, but we think this is the best grouping to achieve the most outcomes.
I haven't had anybody say they don't think they're the right ones, but I will open it up, see if anybody thinks they should be different. They're all outlined. Robin?
Yeah, I've got a separate point to make, if that's okay, Chair. I'm personally very happy with the priorities. I'd just like to see within the strategic aims and also the MOU, that this is placed within the 2040 strategy. It's absolutely implicit in everything that's in both the presentation and the MOU. I'd just like to see it more explicit so that people who are less well versed on what we're trying to achieve are able to join the dots more easily than they would if they saw this document in isolation. So for both the strategic aims and also the MOU, I think we need to make sure it's more explicit about
2040.
About 2040 and how this work is going to contribute to 2040.
Take that away.
That's Chair.
Yeah. Thank you. Anybody else? No? We're happy to go with the programme, the report that's before us tonight, bearing in mind Robin's amendment. Agreed? Thank you very much. We now move on to item 11, which is the ICB and the ICP reports. Yeah.
Okay, I think that one's for me, Chair, to pick up. So the paper is for noting for the board, but I'll assume the paper is read, but what I will do is just give you a very brief overview of what we're talking about, and then with other colleagues in the room, if you've got any questions, we can look to build those collectively. So the paper sets out the changes within the ICS and the introduction of the Integrated Care Board and the Integrated Care Partnership. The ICB is a new statutory organisation taking over from the functions of the Blmk CCG, which is the governing body of where we are and what we're talking about. Our CCG, as a result of that, will cease to exist from the 1st of July this year, and that's the target. That then moves us on to the ICP, and that's a statutory committee comprising of the 4 unitary authorities across the Blmk. And it's an integrated approach to working across place, a system level. So it's quite fundamental when we're talking about place work, how we're shifting the JSNA and what we're going to actually deliver. And what's fundamental with that is actually how it complements the Health and Wellbeing Board as well. The activities and the strategies coming together through a single delivery plan that we've been talking about. So on table 3 of the report, you've got, it actually sets out the different component parts of what we have in our health system, and hopefully starts to illustrate the different elements and the parts that we're playing within that space as well. What I should also mention briefly is there are changes to the arrangements with regards to memberships of the board. So with the ICB, what we've recommended, and that's been agreed at exec, was that Robin will be part of that exec committee. And then for the ICP, we've got Hazel as one of our members as well, and obviously he's the chair of the Health and Wellbeing Board. And then we have 2 further members that have joined the ICP as well to give us the governance and the join up across the health and wellbeing into the ICP. So happy to field any questions.
Members will have seen these before, I think. But are there any questions from anybody? No? Be happy to note this. Yes, Robin.
This is going to be a really unfair question.
No.
I love the way you
Go on then, Nikki. Go on then.
I am Nikki. The health system loves readjusting the debt chairs. How long do you think this iteration of the structure is going to be around for?
It is unfair, but I'll have a go at it. I think it is absolutely the direction of travel if we fulfill what the policy is intending, which is decision making as close to the population as possible. And I think working in this system in Luton, I love it because it's getting to the heart of the problem. And it is all those inequalities. So I'm absolutely, completely and utterly on side with your 2040 vision. It is the only way forward. So I think if we work together and really harness that spirit we have in Luton. And I do say it's the people we serve where the spirit comes from. So completely the communities and the community voluntary groups that we have, if we can harness that, I think we should be a role model. People talk about the Wigan and the Barnsley. So I think we should get our, the Luton name on the map. So I think, as far as politics go, I think it will have as long a run as we make it work.
Excellent. Thank you.
You were prepared for that one. You were prepared for that. Okay. So I'm going to move the report there. Oh, sorry, Phil. Yes.
I just come in there and say I think it will be as long lasting and as successful as people make it, as long as the ICS concentrate on economies of scale and best practice learning and stuff like that, and the Luton Place Board focuses on Luton and what Luton needs, and both of those organisations talk to each other and not work, as Nikki said earlier, in silos. And everybody, and going back to the Luton Place Board, people not working in silos but talking to each other. I think it's up to everybody here and everybody else to make it successful and make it beneficial to the people, and that's what it's all about. And it's about person-centric, holistic, and making it sensible for the people. And we haven't previously had a holistic approach to dealing with people, because we've had, social care, we've had mental health care, we've had health care, and it's about bringing those together for the benefit of people. Here ends the speech.
Thanks, Phil. Anybody else? No? Okay. Are we happy to note the process? Thank you very much. And we now move on to item 12, and that's back to Sally, I think, with this Covid disparities.
Can I just check that there was a COVID disparities report within an iteration of papers, because I couldn't. I've got it, but you've got it. Good. Just checking, because I didn't have it in the document pack that I had.
No, it didn't come out in the papers. It came out afterwards.
Yeah. And then I think I missed that email. So great. That's good. So we have been doing these quarterly COVID disparities reports that outline the impact of COVID in the population and looking at different population groups, so age, gender, ethnicity, and long-term conditions, and mapping that out so that we understand the impact on the population. This new report will be the final one that we're doing, and is looking at the course of the pandemic and looking at that population impact throughout the course of the pandemic. So the report's in front of you, the data's all there, and the summary is there. So I'll just open up to any questions. Unless would you like me to talk through it in further detail? I'm happy to.
I'm open to members. Do you want Sally to go through it in detail, or have you been able to read it? It did come out late. That's why I was conscious that people might not have had the time to read it. Are there any questions from anybody? I suppose that's the real crux of it. No? Nobody's got any issues with the report? Quite an important report, actually, this one. Yes, Robin. Oh, you would just put your hand up. Sorry.
I think because we've been looking at this data throughout the pandemic, and it has informed some of our work and some of our response, I think it is a very important report. But I'm not hugely surprised that there's not any questions, because we've been well versed now at looking at this data. But this is kind of looking at the course of the pandemic and sort of summing it up.
Yeah. So if there's no questions, we're asked to. I think we're asked to just note this report, aren't we? To support the plans that are in place. Yeah, activities already in place to help reduce. Are we all happy to agree that? I think that was a yes. Yeah, thank you. We now move on to item 13, which I believe there is no Children's Trust Board report this month. I'm correct there?
My apologies for that. The report has been completed, so and Sally and I've gone through that, so I'm not quite sure what's happened there. So please do accept my apologies. We will circulate it, but I think it would just be helpful to give a brief overview because there were some really important areas. Sally's touched on some of them already, and helpfully Sally chaired the last meeting of the Children's Trust Board. That linked to the place-based agenda, the work of the ICS and aligning the strategic priorities. But I think the area that where we'd want to just add some additional focus from my perspective, and I'm sure Sally's got other areas as well, relates to the prevention and early intervention area and the development of our family hubs and our offer. So Sally, I'll hand over to you. Thank you.
Thank you. So in the Children's Trust Board, we had a lot of conversations around the early intervention and prevention offer, what that looks like in the new world post children's centres changes, and where there may possibly be risks in the system. So there was an action that was taken away to have a workshop around that, to do a whole system sort of mapping of that picture. Which I think will be really important. We also have just recently, so it wasn't discussed at Children's Trust Board because we didn't have the information, but we've just recently heard that we are in the first wave of some additional funding around family hubs. So it's not, we've put in a bid, it's not that, so that would be in addition if we got that, and we're supposed to hear that imminently, but we haven't yet. So this is around the first wave of a national direction around family hubs, and we've got some additional money. So there's a kick-off meeting for that in the next couple of weeks to look at what that will look like. So I think the workshop that we agreed would happen as an action from the Children's Trust Board, plus this family hubs needs to come together as a work programme. So we'll collectively be taking that forward.
Okay, so that information on family hubs will gradually come out as it comes up. Okay. Any questions from anybody? No? Okay, well, we look forward to the report then. Yeah, thanks. And I've got an item here that I've been asked to raise with members. You will have all received the email regarding the Luton 2040 pledge. Have you all received that through? Yes? Members are being asked to sign up before the next partnership conference in July this year. So there is more information that will be coming out if you haven't received the email, but maybe you, with your various organisations, can sign up to those pledges and let us have them back in time for the conference. So it's just to remind you. Yeah. Amanda.
I just want to add weight to that, because through the Children's Trust Board, there is a standing item, Sally, isn't there, in relation to the commitment of the pledge, and particularly the pledge and development to progress the child-friendly town. And what's really positive is all partners have written and made that pledge explicit, their commitment to that pledge explicit, and also given their commitment to demonstrate how that shows itself in their strategic objectives. And the Children's Trust Board has has agreed with all partners a kind of biannual update on that impact. So whilst that doesn't necessarily take forward the totality of all of the pledges and commitments of the Luton 2040 in terms of that specific area, that's building momentum and commitment around the commitment to the child-friendly town.
Okay, well, that's good news. Yeah. Okay, so it's just a reminder to everyone. And I move on to item 14, which is the revised Health and Wellbeing Board Governance Arrangement Review. That paper did come out very late, didn't it? Yes. To members, which I do apologise to you all for. So I hope you've had an opportunity to have a look at it. Who's moving that one? I think I've just moved it, have I? Yeah. Okay. Okay. So can we agree that? Thank you very much. And then there is the item about, what I did want to raise is the actual attendance at Health and Wellbeing Board, and starting from the new municipal year, that's in May, all voting members, elected members, partners and officers should now return to the council chamber in person to participate as voting members at the meeting. Members can still send a sub to the meeting, but they will have to attend in person. Participation remotely through Teams for people that have a vote will no longer be possible. So I just wanted to report that here so that everybody understands that you will not be able to dial in if you are a voting member.
Chair, they can still dial in. The only difference is they won't have full participation of membership, especially if they are voting.
We won't be quorate,
No,
which means we won't be able to operate if members aren't here. Yeah. So we need all the voting members, if possible. And I realise it won't be practical to say everybody will attend every time. I recognise that, but we will need a group of voting members, at least 7, at each meeting to make our meetings possible. Sorry about that, but that's how it has to work from now on, I'm afraid. And then with the last item, I believe, is the work programme, item 15. And we have a couple of additional items that have been agreed to go on the work programme. One is the Luton Plan evaluation and forward plan, and that will come to the 26th of June. 28th of June, sorry. And the other one is an overview of cancer services, which will come to the 18th of August 2022. So is there any questions on any of the work programme before us? Or is everyone happy to go with the programme that's there? Okay. Agreed? Thank you very much. I think that's the end of the meeting.